Thank you for joining Consumers Doctors channel from Foremost Organization, or known as $K.org. Let's talk about price transparency, which is critical for the lowering the costs of the healthcare. Why do I say that? Let's see. You as a consumer, if you go for any test or any procedure, or if you get hospitalized, or visiting the emergency room, getting a CAT scan done, first thing they ask you is your insurance. But the problem here is, by volunteering to give you the insurance, you need to insist on you signing a bill before they're sending it to the insurance companies. This will bring down the cost, folks, because your price is being transparent. A lot of times they're billing behind your back without your knowledge. Insurance companies is yours. I don't know why people have the tendency to think insurance companies is somebody else and somebody else is paying your. That is so wrong. It is your policy. It is your, even Medicare, it is your insurance company. They should not be billing you without your knowledge. I wish everybody realizes that. Insist on having you sign a bill before they send it to the insurance companies for any test or any procedure, any diagnostic procedure, or telehealth, you name it, folks. You need to insist on seeing a bill before they bill the insurance companies. This will ultimately lower the cost, because now what's happening is you're being billed without your knowledge. They're billing your insurance company without your knowledge. That is so wrong. If it's any other insurance company, they'll have you sign a bill before they submit it to the insurance company. I don't see why we can't insist on seeing a bill before they send it to the insurance. So once I don't want to keep repeating the same thing, but ultimately it is your insurance company, because your premiums are going to go higher next year. So you need to insist on seeing a healthcare bill. Second thing is risk segmentation. I still don't understand why the insurance companies segment individuals by the risks. If you're a healthy individual, you should be categorized as well category. If you're at risk, smoker or drug addiction, any other problem, you should be at risk category. If you have a chronic illness, you should be in the chronic illness category. And catastrophic, if you're if you're an air pilot, if you're anything taking risks, it should be catastrophic. In a short term, most of the catastrophic illnesses are short term. So your premiums have to be based on the risks. I hope you all get it, because by categorizing, insurance companies refuse to do the risk segmentation. I still can't fathom they're getting away without risk segmentation. Folks, I will continue to harp on healthcare, price transparency, competition. Yesterday I talked about competition in healthcare, which is doctors will love to see bring competition back in healthcare. And affordability. Affordability with risk segmentation. Prices are affordable because you're categorized. Your insurance premiums are more affordable because you're a well category, you're at risk. Do you know that chronic illness category, only 12 to 15% of the folks fit into that chronic illness category. But what's happening is you and we are all paying for the chronic illness. People doing drug addiction, people getting into the bad habits, people don't take care of their health. And uninsured, we are all paying for the uninsured. Your premium includes uninsured and everybody else. By categorizing, your cost will go down on your policy. So the chronic illness, only 12 to 15%, but their claims are whopping 50%, folks. So they should be categorized, they should be incentivized to lower their premiums. There are ways to do it, folks, by monitoring closely without being hospitalized. There are several things you can do in the chronic illness category where we can lower the cost by being proactive and incentivize them to lower the cost even in the chronic illness category. Catastrophic, most of the people in the catastrophic category, it is a very small percentage, 6 to 8%, and it's a temporary phenomena. Their premiums have to be based for a temporary period of time. So majority of the folks, 70% of the folks are healthy. Yes, 70%. They hardly see a doctor. They hardly go to the hospital. They hardly go to the, consult a doctor. Their premiums should not be more than $50 to $100, folks. I really believe by bringing the price transparency and by categorizing, you're a healthy individual. If you don't go to the doctor, your premium should not be higher than $50 to $100. Irrespective, even if your age, you can gradually increase it, but it cannot be, $800,000 if you're 60s, which is unconscionable. I really believe we need to bring the risk segmentation to the front line, and the consumers have to insist on paying and signing a bill before the insurance, they bill it to the insurance companies. As a matter of fact, I would like to see the providers get paid only if consumers sign off on the bill. This is a simple thing, folks, and we need to pass a legislation that consumers have to sign the bill before they bill the insurance, and they have to be approved by the consumer. That brings the consumers to the front line of the healthcare. Folks, thanks for listening. Follow me. Wish you all a happy, prosperous, healthy new year. If you stick with me, I will vouch you that you're going to be prosperous, especially not only health-wise, money-wise, by saving and putting money into the health savings accounts, which has a triple tax benefit, folks, triple tax benefit. And you can put that money into the index funds which will continue to grow by 20%, 15 to 20% on a regular basis. You can't imagine how much you can make money on your own health. Follow me, folks. Subscribe, share, make some comments, and raise the thumbs up. Good luck. Wish you all the best for the upcoming 2023. See you.